Hi, my name is Mary Moran.
I'm Izzy Paul.
My name is Loay Abukhalaf,
And I'm Missy
and
Paul.
we are here on behalf of HOSTA Community Awareness because we want to bring awareness to gum disease and dental hygiene because we feel like it's a very prevalent issue that's not talked about regularly, and we feel like we can make an impact to our community if we talk to you about it. So could you please briefly introduce yourself?
Yes, my name is Loay Abukhalaf. I'm a dentist here in Carmel, Indiana. I'm a general dental office, so we do have obviously hygiene patients as well as other restorative stuff going on.
So, what are the common symptoms that you see for gum disease?
Uh, Symptoms mainly patients initial stage would be bleeding. They complain of bleeding while brushing or flossing. Usually it's painless, and that's what makes the gum disease more scary because patients don't have pain, so they don't come seek help until it's pretty bad. So initial stages is just a little bit bleeding, a little puffy gum, flossing sometimes hurts. That goes in, it gets better once they floss or clean, and then they don't seek help. Uh, that's the initial symptom is bleeding. Some people complain of a little bit bad breath. Uh, that's another thing. Uh, that's the initial symptoms. Did you want me to go through advanced
I think,
or?
yeah, yeah.
Okay. So once the initial, let's say the initial, it's called gingivitis. The diagnosis is gingivitis, which is inflammation of the gum. It does get better with, it can reverse completely with cleaning and um, or oral hygiene. But if it doesn't, it can go to stages where now it's called periodontitis. Periodontitis is gum disease that now it's advanced. The tissue is actually not as tight around the teeth, and you start having space between the gum and the tooth. And what happens, bacteria can go down there, live in those pockets, and nobody can clean them. Like the patients cannot access those areas. So the bacteria gets in there, and it gets nourishment, and it grows, and it can destroy more in the tissue and gets deeper, and then now it gets in the bone level and start eating the bone away. So you get bone loss around the teeth, all because the bacteria got in there and nobody went and cleaned it out. So the more advanced, the more bone loss you have, and then eventually you get quite a bit bone loss, significant that the tooth is loose. There's nothing supporting it, and patients lose their teeth because of periodontal disease.
Oh. Thank you. So once it's gotten so severe, what does like the prognosis look like? Like what do dentists do to help reduce this, or like what does the medication look like for gum disease?
And so initially gingivitis, which is the initial stage, cleaning, just regular cleaning and trying to keep oral hygiene at home, flossing, brushing, all that stuff. Once it gets a little more advanced, we do deeper cleaning initially. We can go numb the patient, be able to go a little bit deeper in those pockets, clean the bacteria out, clean the buildup inside, and hopefully get the tissue to tighten back up on on the tooth, so you don't have pocket where bacteria can get in there. If it gets more advanced, deeper pockets, we sometimes go to surgery where we actually numb the patient, reflect the gum away from the tooth, clean everything out, clean the bad tissue out, and suture it back up. So that's more aggressive. Sometimes we have to recontour the bone around the tooth so that it's accessible for the patient to clean. Like I said earlier, once you lose the bone, I cannot get it back. So if we have bone level and we have, let's say, 6, 7 millimeters of tissue on top of the bone that's unhealthy, you cannot clean all the way down. So we reduce the tissue, so we expose more tooth so that the patient can clean, and now they don't have a pocket anymore. So the pocket was 7 millimeters, now it's 3. They can at least floss or clean it. So the deeper the pocket, the more problematic it is. So we clean, we debride the area. We actually sometimes do osseous surgery where we contour the bone and the tissue. Eventually ends up with the tooth loss if we cannot get any of that stuff under control.
Yeah, and are there any lifestyle choices that make gum disease a little bit more prevalent?
Lifestyle?
Yeah.
Well, there are a lot of connections between gum is part of your body. So let's say smoking doesn't help. Diabetes shows that if you're diabetic, you are if you're diabetic, it's harder for you to control periodontal disease. And they call it the double-edged sword, where if you're uncontrolled diabetes can cause periodontal disease to be uncontrolled, or uncontrolled diabetes can cause the periodontal disease to be under control, not controlled. So controlling one of the diseases can help the patient control their other disease as well. It's linked to some cardiovascular like heart problems as well, because the bacteria that's sitting in the gum, the blood flow is going. The bacteria is actually getting in your bloodstream and goes to throughout your body. So if you have inflammation anywhere in the body, your heart or anything like that, it can get stuck on those bad tissue wherever it is and cause infections. So that, and then what else? It's just not good to have infection in your gums. I mean, it's just not good.
Do you think that there are any common mistakes that people often make during their dental hygiene routine that can make them more likely to have gum disease?
The patients, what you said?
Do you think that there are any mistakes that people make when doing their dental hygiene routine that can contribute to gum disease?
They're just not following up with the dentist. And when we recommend deep cleaning, they always, most people say, can I just have regular cleaning? Because deep cleaning is more expensive, takes 2-3 visits sometimes to get this done. They just want the easy way out, and it doesn't work that way. Mm-hmm. A lot of patients, I actually refuse. They say, just do the regular cleaning. I say, you can go somewhere else, do the regular cleaning, because if I do regular cleaning and you need deeper cleaning, I'm doing you a disservice. I'm making your teeth look clean, but I didn't clean the problem. The mistakes is that. And then another thing is there's a genetic factor for sure. So some people are very, very good at home. They do oral hygiene. They come to the dentist all their lives, and they still get the periodontal disease. Compare that to somebody who they work out, they eat healthy, they do everything, and they still get hypertension, or they still get diabetes, or they still, and some people don't give a crap and nothing happens to them. They come in and they haven't seen a dentist for 20 years and their gum is perfect. Or not the gum, there's no bone loss, zero. Some patients smoke for 20 years and they don't get lung cancer. Explain that. I don't know. I think there's genetic factor how your body reacts to some things that make you prone to disease, and it's your genes. So.
All right. So lastly, our last question is, what's your biggest advice to the community, like including kids, just like a straightforward piece of advice you would give to like everyone to prevent gum disease? It can be.
Kids, start with your kids, bring them to the dentist at a younger age to get them in routine. They know this is something that I have to do from younger age. Establish that in their head, like, oh, I have to see a dentist every 6 months. Seeing a dentist, catching the disease at early stages is way better than trying to play catch up with the disease. Coming after 20 years of not doing anything, there's nothing I can do about it. But if you come here every 6 months and we start seeing signs of inflammation, bone loss, all that stuff, we can prevent it from getting worse. I think I don't know the statistics, but I think over 50% of the population have periodontal disease. It's out there and it's being underdiagnosed. A lot of dentists, unfortunately, don't diagnose it and then don't treat it, and you end up they wait when it's stage 2 or 3, and now it's like, okay, now we have other issues going on.
Well, thank you so much.
problem.
We really enjoyed asking you all these questions,
Thank you.
and we really think your information that we learned from the Zoom will help our community. So thank you.
Okay.
Thank
Thank
you
you.
so much.